Welcome to the dvm365, live from CVC San Diego. I'm dvm360 Business and Team Channel Director, Brendan Howard. Although feline injection site sarcomas are rare, they're devastating when they do occur. Invasive and disfiguring surgery is often the only option for cats who develop sarcomas, and many owners choose euthanasia instead. Now, researchers from the University of Florida may have found a better way. Shelter medicine expert Dr. Julie Levy is reporting that vaccinating a cat in the tip of the tail appears to be just as effective as a traditionally administered vaccination. In the rare case that a sarcoma does occur at the vaccine site, surgical options for the tail are much more palatable to pet owners, meaning many more clients could pursue cancer treatment, potentially saving thousands of feline lives per year. Veterinary experts are around every corner at CVC. We caught up with board-certified cardiologist Dr. Sonia Gordon, who shared this tip.
One of the most important developments in canine cardiology over the last year involves the completion and reporting of a landmark clinical trial. The clinical trial looked specifically at Dobermans with dilated cardiomyopathy, and it was aimed at trying to identify these dogs before they developed heart failure and initiating a medication. The medication is pimobendan or vetmedin, and if we initiate this medication before they develop heart failure, we can prolong Doberman's symptom-free life by 62%, which translates to 9 additional months that your dog would feel good over the course of their life and also live longer. And that's a really important thing because it's the first time in veterinary cardiology where we've shown that if you can identify a patient before they get sick and start a medication, that you can change what's going to happen. And frankly, that's changed what I say to clients on a day-to-day basis.
Compelling stories show up at veterinary practices every day, says Dr. Ernie Ward, and team members should keep their eyes open and share those stories on social media. The results benefit everyone.
When it comes to team members and your role in social media in the practice, I say you are critical. You are content creators, so what I tell my staff is constantly look for stories. If you see a cute puppy, if there's a dramatic medical crisis, I mean, whatever it is that you can share and educate on, those are the types of things we want to Facebook and tweet and pin about. So I'm saying your responsibility is find me those stories. Second thing is, maybe you can even do some of the posting for me. I can make you a content creator on my Facebook account, and if I say, hey, that's a really cute picture, can you go ask Miss Smith if we can get a picture of her puppy and put them on our Facebook page? You drive traffic. Plus, it's less work for me as the veterinarian or the owner. And then finally, I think that you as staff members need to understand that we are creating stories that impact people's lives. So these stories can save lives as well as educate clients on what they should be doing or shouldn't be doing. So this social media phenomenon, it only continues to expand what we do as veterinary service providers. And remember this, every post, every tweet, every pin could save a life.
Your feline patients can slip through the cracks. Dr. Elizabeth Colleran says it's essential to mine your own database and client base to catch those missing cats.
One of the things I realized in my own software is that after the reminder number that I had specified was not responded to by a client, those clients disappeared. So I had to go back and mine my own database to find out who were the people that I hadn't seen in years and years and go figure out where they were and call them. So we set up a special time every day when our assistants would actually call people that hadn't been in for a year or so. The other thing that's really important in small animal practice is to ask people. They're bringing in their dogs, ask them if they have a cat, or 2 or 3, or if they're feeding somebody in the backyard. That's really important to go after the ones that we're not seeing.
We all know one reason clients hesitate to bring their cat to the veterinarian is that it's not a pleasant experience for anyone, especially the cat. But veterinary behaviorist Dr. Valerie Tynes has one tip to make every cat appointment a real treat.
Well, one of the first things I'd like to see practice owners and veterinary associates all do is invest in a little bit of food treats for cats. And sometimes I encourage people to think out of the box when it comes to picking food treats. I'm not talking about dry kibble or the little dry crunchy treats that a lot of people have on hand, but rather some really special high value food treats like some tuna fish, some chicken baby food, and every cat that comes in your practice should at least be offered little food treats while you're examining them and while you're hopefully doing anything that you have to do to them, as long as anesthesia is not going to be involved.
We hope you've enjoyed this edition of The Five. If you have suggestions for future shows, email us at dvm360@advancedstar.com. And for the latest news, medicine, and business, I love business information, be sure to visit dvm360.com every day.